very fortunate to have primary health in our communities, and they do a great job. And now they're conveniently located right up here across from the hospital, the old hospital. So we'll let Rick and James tell us a little bit about primary health.
Yeah, no, I'm really excited just to be here with you all. Thanks for your invite. I've been serving as a CEO for the last 8 months.
Oh, okay.
And, we have a new mission statement, which is exciting for us.
Oh, yeah?
Yeah, our mission statement is to reveal God's love through high quality and accessible care for all. And so we really believe in compassionate care. We really want to make a difference in the lives of our community. We have a sliding scale as a nonprofit organization. We see everyone, no matter their economic status, and so a good 25 to 30% of our patients we see on the sliding scale, and that's just our blessing.
Well, I was telling Jay earlier, I've used primary health, and I did on a Monday when I didn't want to sit in the doctor's office half the day, and I had poison ivy, and they take my insurance card, and I pay my copay, and I'm in and out in no time. And I used it one time for the sinus infection. So it's a good thing. I mean, you don't have to just be on a sliding scale.
Correct. Yeah, we take insurance, Medicaid, Medicare, private insurance, pretty much every insurance out there we accept.
And then you have a pharmacy.
And now we have a pharmacy. We just opened up our in-house pharmacy.
Yeah.
Really excited about that. Our in-house pharmacy has a special program called the 340B program, and it's unique to federally qualified health centers such as primary health care centers. And what it does, it really allows our patients to get significantly reduced cost medications. And so there's only a handful, probably 3 or 4 in the whole greater Chattanooga, North Georgia area that have that ability to provide that discounted medication. Now you do have to qualify for that 340B discount, but it is a huge blessing. So we're excited about that.
And the thing too about your pharmacy is convenient parking, and they have their own entrance. You don't have to go through.
Where's it at?
It's off of Mitchell Road, so it's right across from the old CHI Memorial Hospital, and we have a clinic there. And then the pharmacy is in that same building with a separate entrance.
Across from the ER. Across from the ER.
Okay. Now, didn't you have a pharmacy before, like a kind of small or something for the patients?
We never had an in-house pharmacy before, so this is our first one. We had contracts with other pharmacies in the area, about 43 pharmacies. We had contracts to offer the 340B. But the advantage with having an in-house pharmacy is that we can get significantly even more reduced medications. And it's just convenient as well. We're going to open in January direct shipping to all of our patients for those that don't want to drive in. We can ship it directly to their home, and so that's going to be another
very convenient. So tell us during this, I remember this too, just an example, you work for a company like Roper, and a kid gets sick. You have clinics now in the schools where you can call mom and she gives permission to go on and treat the child. Tell us about that.
Yeah, no, we have 3 school-based health centers, 2 in Ringgold, one is Tiger Creek, that's been there for a while.
That was our first one.
Our first one,
I remember that.
And then we have one that just opened up in Ringgold at the Catoosa College and Career Academy. And then we have one at Gilbert Elementary School. And we're trying to also get one here at Roscoe. We are trying to get a modular unit to open one at the Roscoe Elementary School.
That'd be nice.
So the advantage of having the school-based health centers, it really helps the parents and the kids who are the kids are in school, not have to take off a day, or they can just get care immediately right there on campus. And so it allows them to stay in their seats and just get that more quick access. And it just lowers absenteeisms, quicker service, and of course our passion is compassionate care.
Now is it open up to the public too?
It is.
I knew one time it was. So and how many do you got on a bed now? You got Giver and another one, right?
Yeah, so we have Gilbert, and it is all our school-based health centers are open to the public as well.
Okay.
The other one is in Linwood. It's a little housing development there in Lafayette.
Okay.
And so that one is always full. Great provider there.
Yeah,
So,
yeah. Well, I'll tell you, primary health care it's a blessing. I truly think it's a blessing to our area. So, a lot of people didn't have any providers or anything, And like I said, I was on board for a long time. And I think it was mandatory that we use a percentage of it. And I start using it, and then I use it all up in time I left,
It was so convenient.
yes.
And
it's a blessing because you're right. Our patients are on our board. And that's something very unique compared to other healthcare centers. They're always recruiting maybe, top leaders in the community, which you want, as well. But we pride ourselves in being able to have our own patients on our board of directors so they understand, their service, how we can improve our services. That's very exciting. Another thing that we're excited about is our pediatrics. So we have pediatrics in Trenton, but we found that there's a lot of folks that don't have access to pediatrics in Fort Oglethorpe, and Walker County, in fact, doesn't even have pediatrics. We're right on the border of Walker and Catoosa here. So we've added 2 pediatric clinicians in our Old Lafayette Road office, which is also very close to see.
That's a nice office too.
Yeah, so we have Dr. Litwin, very experienced pediatrician. She is also certified beyond the pediatric side, but certified in lifestyle medicine and diabetes education.
Yeah, I remember going to the open house one time at Fort Oglethorpe, and I was shocked when I saw how big their lab was.
Yeah, we have
a full lab.
Lab services, we have vaccines, we have case managers, which are like social workers to help with the social determinants of health, anything from transportation needs to we try to do referrals to our local food banks. When there's a pinch, we try to help out with medication needs, those kind of things. We have a dietitian on staff that everyone loves. Danielle.
Danielle used to come here and just show time.
Yes, I have to say.
She is good.
She is. And so we love that. That whole person care is what we really go for. We also have behavioral health. One of our favorite staff members is Felix. He's a child play therapist. And so he works with a lot of the kids, especially in our schools, to do play therapy. And I wish when I was doing counseling, I wish I had play therapy. I was like, sounds like a fun way to do counseling, right?
Yeah.
So, and James is, we're excited to have James on board. He's our new development director. And so, James, maybe you can share a little bit about, some of the development aspects.
Today is Giving Tuesday. I would be remiss not to mention that. We are a nonprofit, as Rick said. What that means is, all of these great things that we talk about wanting to do in the community, it's made possible through the support of the community. And so Giving Tuesday being, a worldwide day of giving, that's an opportunity for folks to, give back in their community for the nonprofits or services that are near and dear to their heart. And so we invite people, and we're grateful and blessed with any opportunities for support, just so we can keep doing what we're doing and keep building on what we want to build on. And investments like we've mentioned with new centers, modular units, addressing different program services that we can. That's really made possible through support from the community. So Giving Tuesday is a big day for us. We invite you guys, if someone does have the means to support, we'd love to have your support. But in the development world, we're making a lot of strides. We want to make sure that the community understands us as a nonprofit health center, which we have been for more than 40 years. But really what that means and how we are different from, just a typical, primary care private
Right.
practice. And that's how we're able to serve patients without insurance. That's how we're able to serve patients on Medicaid. The pediatric side, with us expanding there, a lot of that had to do with, it's a lot harder for a private pediatrician to serve communities on Medicaid now because the reimbursement rates are really low. But with us, we want to fill that gap. We don't want, just because a family has Medicaid or has no insurance at all, we don't want children's health to be delayed because of an ability to pay.
We're excited about the pediatric, especially
I didn't
because
know that.
not only do we have clinicians that really believe in natural remedies as well, but they're going for lifestyle change, good nutrition, exercise, and getting out in nature. That family time is so important. It's just
Drink more water.
drink more water. Those are the basics we all struggle with, right?
Yeah,
I
that's
struggle
right.
with it too. So we love that about our clinicians. They're very much into just helping our folks not only get better when they're sick, but prevent sickness through those lifestyle changes. The other thing is a lot of pediatrics in the area don't always don't always accept medication, but Medicaid. But a lot of them also are struggling to accept patients that don't follow the vaccine schedule. And insurance really dictates in many ways that you have to be vaccinated in order to see your local pediatrician. So most pediatricians in the greater Chattanooga area actually have kicked out a lot of families for not following the vaccine schedule, whether it's a delayed or don't want vaccines at all. So with us at Primary Healthcare Centers, we always believe in choice, right? We're not anti-vaccine. We're not going to coerce or use fear to, push people to do what they don't want to do. So choice is a really important part of our mission in how we provide care. So if families prefer to have a slower vaccine schedule, spread those, dozens of vaccines out over many, years, we'll work with that. Or if those that don't want to have vaccines, we will work with them on trying to build up their immune system naturally.
Well, what about flu shots?
Flu shots. So we offer flu shots. We offer all the vaccines, but we offer choice as well for those that want. And that's, I think, really important because we don't want insurance to dictate how we do care. We want to let the parents at the end of the day decide, and we support their decision in trying to help their family be healthy.
That's good.
Wow, that is
What do you see with the COVID vaccine? Are you seeing more people taking it or less people taking it? Or?
Yeah, there's a lot less people taking COVID vaccines. And I think, we know that initially there's a lot of people taking it because, we didn't know, how effective it would be, right? But now we know that research shows that, the COVID vaccine only lasts a few months, right? 6 months or so. And so a lot more people are saying, is it really worth it? Now, if you have a lot of, comorbidities, right? You're having, immune challenges, you're dealing with chronic diseases, maybe you're a little older and your immune is not as strong, that may be an important choice. If you're younger, so at the end of the day, you have to weigh the pros and cons, right? And so we let people do that. We want that choice to be a part of it. We're going to educate on the pros and cons and then let each person make that decision.
Do you do eye exams?
We do some eye exams, but we have to refer out to ophthalmologists, and especially when we're trying to get those contacts and glasses, so we have to refer out. There's a lot more we wish we could do, but there's only so much you can do in one place.
Right. I'm gonna tell you, man, that's come a long way. And do y'all still work with the health department?
We do. We work with all the health departments in the area. We meet with them regularly. We just had not too long ago a meeting. We're having actually a planned event with the health department. James, maybe you can share that.
Well, it's the Catoosa Collaborative.
Yeah.
It's if y'all know JC,
Yeah.
she's a rock star. She kind of initially she came up with this idea of doing a health fair that'll take place in April, and it's separate from your kids' days that you have in July.
Oh, okay.
So the goal is the kids' days are great. A lot of families come out to those, and those are going to keep going. But we wanted something too that was also meant for adults, families, other people that don't get a ton of opportunities to take care of their health if they're working hard and they don't get a lot of days off. It's just a day that we can kind of try to bring all the services in one area, between what we do, the health department, different specialists.
Health fair.
Yeah, it's going to be a big health fair. It'll take place in April. JC's already been on the ball with everything. She'll have a ton of people. It'll be at the Colonnade. I have to look at my notes, but I know it'll be at the end of April. And we'll have food vendors. There'll be businesses out there, and then there'll be a lot of the health resources in the area that'll be there as well. So essentially, someone can show up, and if they haven't taken care of anything, whether it was an eyes or blood pressure or anything else, they can take care of it all in one day right
Maybe
there.
y'all could come back and talk more about that.
Yeah. Oh yeah. Yeah. I'll certainly get with JC. This is her little baby right now. So I don't I'm not taking any credit for it. She's working with us in the health department. I'm just trying to help organize what's possible for us to do in terms of exams and things that we will able to provide for folks that come out. But she's done an incredible job already, and I think we're gonna have a great first year with it, and I'd love to see us start doing it annually.
I just think it's wonderful that they all work together, and because they can consolidate resources and just really able to help a lot of people, So.
Yeah, I think we all kind of come from the same mindset. In the nonprofit world, it's how do we get more care to families? How do we help more of the community? And so between the health department and between the family connections, the collaborative groups, there's just a lot of
retail.
And it's so good to just see so many people come together just in the name of the community and what they can do for them. And so we're real blessed to be a part of that too. And so more things like that we can participate in and we can be involved with, we definitely want to.
That's wonderful, isn't it? That's great, man. That's great. Yeah.
What I love about the health centers, the whole mission of the health centers is to collaborate. Where a lot of the healthcare systems are competing, we have, from our DNA, is to collaborate. We collaborate, whether it's Erlanger or CHI Memorial, whether it's your pediatric office down the road or your chiropractor office next to you. We really believe in that collaboration, and that's where the patients win.
Oh yeah, you're right.
It's when you have competition that's negative, the community loses. And so we value that. And I'm excited about our providers. We have some wonderful providers. Right now, over the last couple of years, we've had about a 97% satisfaction rate.
Wow, that is great, isn't it? Yeah.
I love to hear that from the doctor's office. 4 and 5 hours to get in.
Yeah, we try to get you in same day when you call in. In fact, my own daughter's sick, and we're going to get her in today to one of our clinicians. And so I'm glad to take my kids, to our services.
Well, that's what I said. It was a Monday, and I've been sick all weekend. Actually, it was at the clinic over in Rossville the first time I went. And I stopped at this red light, and I thought, I'm going to help. So I just pulled in, and he took me right in.
Yeah, and sometimes when people walk in, we're not like urgent care. We always have to say, sometimes we have the opening, we get you right in.
Right. This was 8:30 in the morning.
8:30. Yeah, I'm glad you were able to get in. And sometimes we have to say, our next opening is in the afternoon. Can you just come back in the afternoon? But we always reserve a few spots every day for that same day appointment.
Yeah.
So we're grateful that you all are supporters, and we appreciate your many years on the board.
Oh yeah, I really enjoyed it, man. I think some of the people, the same people on the board that was on there when I was on there,
Yeah.
one lady, I can't even think of her name. Yeah, is she still on there?
Yeah, she Mary. She's
Mary.
Yeah, she's very beloved.
Oh yeah, she is, man. She's a wonderful person, man. Yeah, I've seen that. I've really seen that organization grow, man. And I'd say it's a blessing, man. So many people use the services, and y'all got plenty of doctors or physician assistants or.
Yeah, we currently, I think we have about 5 or 6 physicians,
Okay.
and then another. I'm just giving a rough estimate. About
Oh, yeah.
10 nurse practitioners.
Whoa.
And so, yeah, it's definitely been busy. Just in the last 3 months, I think we've been really trying to reach out to the community more, let them know that we're here to serve.
Yeah.
We've had a 10% increase compared to last year over the last 3 months, and so I think as we're starting to add some more services like pediatrics and pharmacy, as we're adding really great clinicians to our team. People are seeing, the impact that's having in the community.
That's great.
So how do they find you? I often imagine what it'd be like without Diana, and it seemed like they found a perfect guy. It seems like so I don't know how long you been there? Where'd you come from?
Yeah. So I've only been there since February.
Okay.
February. Diana did a fantastic job.
She did, man. She's a hard-working, elegant person. She's a good person. Did a lot of hard work. So
yeah, we appreciate the amount of work that she accomplished in her career. And so now I'm just building on what she's started, and our whole team is a whole team effort, right?
Yeah.
And so we have a great leadership team. I'm really blessed to work with.
Okay.
But yeah, we're excited. We have a vision to continue to make a difference in the lives of our patients. We're providing some additional services beyond pediatrics and pharmacy, spiritual care. We have volunteer chaplains. Providing that as well. We're trying to connect with local churches, to refer patients if they're looking for a spiritual, faith community, to be a part of that.
That's good. That's wonderful.
And we're focusing on lifestyle medicine. So where we're headed is we really want to see our clinicians become certified in lifestyle medicine, which the American College of Lifestyle Medicine has a wonderful training program. It's helping our clinicians to understand that medications are important. We believe it, but lifestyle changes affect so much, right? And so you can deal with the root causes of disease through lifestyle changes like good nutrition, water, exercise, adequate sunlight, healthy, exercising with fresh air, those kind of things. So it's easy for us to get into the mentality, oh, here's a pill, and that's, there's a time for that pill, but how can we help our patients, empower them to deal with that root cause of disease? A lot of people don't know, for example, like diabetes, that you can often reverse diabetes through lifestyle change, right? And so many patients do that, get off their insulin.
That's great.
And so there's so many people that don't even know that. They think, they have, a life sentence when they, become diabetic, right? And they're on insulin. But there's so many stories of people, improving their health, whether it's lowering your cholesterol or, lowering your blood pressure.
He's talking to me now.
Well, me too. My family has a history of heart disease, right?
Well, high cholesterol.
High cholesterol, So it's one of those things where, my dad, at 51, he had a quintuple bypass, right?
Wow.
And so I'm just turning 46 here, and I know that that's my hereditary challenges. My grandmother, from my dad's side, had a heart
Get to
attack.
it before it happens.
I have to get to it, right? I have to make those lifestyle changes now, unless I want to have the same story repeated. And so that's a passion of ours. We really want to help our patients prevent those unnecessary episodes.
So you're gonna do any type of like community educational?
Yes, and along with what we're trying to do is that health fair, we're starting to work towards planning a number of health education classes in our community, different lifestyle challenges. Like in Trenton, we're planning with another local organization to have a diabetes reversal class, how to reverse diabetes through lifestyle changes, right? It's all
Yeah, they call Judy, see if they can come back on the show and talk about that, man. Yeah, because that would be great, wouldn't it?
Yeah.
Yeah, that would be great.
It's exciting for me, my background is public health, right? And I've seen just over and over powerful stories of people getting better when they tweak their diet, they start exercising, and sometimes it's hard to do it by ourselves. So we need a support group, right? And that's why these classes, like you're saying, supports that journey. We encourage each other, we keep each other accountable, we call each other up. So those are the things that we're really starting to emphasize.
Well, I need something like that. I need some kind of senior group, because, man, I'm going to have to do something, join the gym or something.
That's the best way to get in touch with you.
Well, so you can always go on our website. We have all of that information that we talked about here. Plus, you can make appointments online. It has all of our locations, for different clinics if you're in different areas. We also have our way to donate onto our website as well. So if people are looking to support for Giving Tuesday, there's an option there. And then, aside from that, we've got locations kind of sporadically all over. And so,
what's our website, James?
Our website's primaryhealthcarecenters.org. And so you can go there. You're more than welcome to give us a call. Number 706.
We have several phone numbers.
Yeah.
But just go to primaryhealthcarecenters.org. And if you go there, there's our different locations, our phone number. You can book appointments directly online through that website as well. So we try to make it easy.
Get refills on your medication through our pharmacy online as well on the same website. We've got everything there. We've got locations wherever, and as you said, Susan, a lot of people do tend to drop in when they need a visit, and hopefully we're able to get a lot of folks in on the same day.
We appreciate you coming out today.
Yeah.
We appreciate y'all having us. It's been a big blessing. Good to see you both as well, and we've got a lot more exciting stuff on the horizon soon. So we'll keep you guys updated.
Well, thank you so much. We need to take our last break, but we appreciate Primary Health Care Centers coming out and talking with us and updating us on everything they have to offer. So at this time, we'll take our last break.
Compassionate care with ease at Primary Health Care Centers.